Okay, thank you everybody for coming to participate in my informative speech for my public speaking class. I want to talk to you about MRSA, MRSA, that's methicillin-resistant Staphylococcus aureus is the medical term for it, MRSA. And what it is, it's a bacteria that is resistant to antibiotics, and it can be life-threatening. It affects the skin, especially in burn areas and wounds, and in hospitals, you can contract it from IVs or catheters or ventilators, anything that's invasive to the skin that opens up into the skin, the MRSA bacteria can get inside. And once it's inside, it can affect your eyes, your bones, your heart, your blood, and when it gets in your bloodstream, it can be carried to sensitive organs like your heart valve, the linings of your heart valves and your chamber in your heart, the lining of your lungs, and you can develop pneumonia. The challenge that health officials have now is the recent outbreaks of different strains of MRSA, such as the H1N1 that everybody's familiar with, that's life-threatening, or the H5N1, which was the bird flu that you could contract through the air, and it gets in the lungs, and then it spreads from within. Now, what causes MRSA? MRSA is an infection, a contagious infection, and it's 50% of all infections of MRSA occur in a hospital because the people that are in the hospital already have weakened immune systems, so their bodies have a hard time fighting off any kind of bacteria infection that they get. And now there's a community-acquired MRSA that's out there that people are bringing into the hospital that they get from being around a lot of people, such as classroom settings, daycares, especially where kids share toys or they share towels, water bottles, because when kids share toys, they share saliva. It's prevalent in small closed quarters, like jail inmates who have to live in barracks, or military personnel that have to live in barracks, but gym room lockers where athletes have to go and change anywhere where it's warm and it's moist and there's a lot of people in a closed area, that it's very prevalent. Now, with all of us, 300 out of every 1,000 people are carriers of MRSA, and you carry it in your nose. That's the easiest place that it travels. Yes. Now, in the past, hospitals have closed due to MRSA outbreaks. I think you've heard of Typhoid Mary. Decades ago, that was a nurse that was a carrier, and she carried it in the hospital, and it spread rampantly because once MRSA infects you, it really, depending on how it mixes with other toxins in your body and how weak or strong your immune system is, it can kill you within 12 to 48 hours once it gets in the bloodstream and hits your lungs and your heart. So Typhoid Mary, there were no well-known antibiotics back then, or no way to combat it, and it closed hospitals. I mean, they literally had to close their doors. The blue-blotted plague is another strain of MRSA that was an epidemic, that became an epidemic and killed thousands of people. It spreads quickly, as I said, in hospitals because people have weakened immune systems. But who else is at risk are, as I said, sexually active teens are on the rise for MRSA outbreaks. I don't know why that is. Maybe they don't keep themselves clean, I'm not sure. But that's another group of people that is on the rise of getting this infection. And guess where else you can get it from is your pets. Your pets are carriers of MRSA. So if you've got chronic colds or bronchitis, or you're constantly catching something, it could come from your pet. So you should take your pet to the vet and have them check their nostrils and their ears to see if they've got the bacteria in there. Last year, researchers found MRSA on a dairy farm, and it had infected the cows. But before they could control it and rein it in, it got into our food supply, and it causes mad cow disease among livestock. And with our food at the time, remember, we were having to make sure you cook your meat thoroughly. And that's the only thing that can really kill the bacteria in our food chain is to cook it thoroughly, because that will kill the bacteria. Symptoms of MRSA. Staph infection comes from MRSA. Now, staph infection can attack just one part of your body. It can leave you with stunted growth. It can leave you with permanent damage to your body, such as your legs or your arms. And, and it can be life-threatening as well. It attacks the soft tissue of the skin, and I've got pictures here. This is the MRSA bug itself, the bacteria itself. Okay, this is, children at play and they share toys and they can catch it. This right here is the cellulitis. That's when MRSA gets underneath your skin in the deep layers of your soft tissue, and it can infect an area, and it gets warm to the touch and very sensitive. And once it gets under there, it's just really close to your bloodstream, and then that's when it can be life-threatening. This right here is a simple wound that is MRSA. And it can look like a deep abscess or maybe small abscesses. If it has a little pus to it, that can develop into MRSA. Okay, and let's see, cellulitis we talked about. Diagnosing, how do you diagnose MRSA? Diagnosing MRSA is from, doctors do it by taking blood tests, or they can swab a sample of this pus from the wound, and they can culture it, which means they have to put it in a culture dish, and they have to let it grow, and to pinpoint what kind of strain it is, because that's the key. There are many strains of MRSA that can develop. The complications are, once it gets into the bloodstreams, as I said, it causes what they call sepsis or blood poisoning. And as I said, if it reaches the heart or the lungs, it can infect and inflame your heart lining and your lungs and give you pneumonia. The treatment is early detection. If you see a spot, on you like that, I guess, then you need to treat it with alcohol-based bacteria-killing agents. And a doctor can diagnose it by taking a urine sample, as I said, a blood test, or swabbing the pus area and then having it cultured. Drugs that kill the MRSA is methicillin, and penicillin-like drugs. But as I said, MRSA, because it's a combination of different strains, it is methicillin resistant. So that is the type of bacteria that penicillin can't kill. And when you take antibiotics for other infections such as cold and flus, what you do is you weaken your body, or what it does is the antibiotics get used to it, and then they're no use to the bacteria at that point, because your body has already begun to be antibiotic resistant. So if you get a prescription for a bacteria for MRSA at the onset, you have to take the whole prescription, because if you don't, like when you get a prescription, they say take it for 10 days, take the whole thing. The reason being is that the bacteria there's some remnants that can be left behind that can actually still develop and grow and get stronger. And at that point, your body's resistant to drugs because you've already been taking them, so it won't do anything, won't do any good now if you get another outbreak of the bacteria. So that is my conclusion of my speech. And I hope I've informed you about what causes MRSA and what develops it and how to treat it.